Cancer remains a major public health challenge in Uganda, with about 36,000 new cases diagnosed every year and an annual death toll of around 24,600 people, according to the Uganda Cancer Institute. That means 3 in every 5 people diagnosed with cancer do not survive.
People don't know the symptoms of cancer, and therefore they don't know when something concerning happens, and they are not able to pick up on an alarming symptom that should bring them to hospital. And then even when they do, there is fear. There's fear of the diagnosis, there's fear of finding out that it is cancer. And then finally, when they get to hospital, there is always that challenge of finances. That is something that keeps coming up for our patients. It delays them seeking help, and it also delays them finally getting the treatment they need when they come to us.
The most common cancers in the country are cervical cancer, breast cancer and prostate cancer, together accounting for a significant proportion of the national burden.
You can be vaccinated against some viruses and that reduces your risk. For example, HPV, the virus that causes cervical cancer, hepatitis B, which increases your risk for liver cancer. So having those vaccinations will reduce your risk of developing that cancer. But even more than that, it's important for us to have routine screening because we are exposed to so many risk factors that it may not be possible for you to avoid all of the risk factors all of the time.
Across the country, communities are being encouraged to participate in early screening programs, which experts say can dramatically improve treatment success. Yet many people still travel long distances for care or delay seeking help until symptoms become severe.
Any part of this country, you've got private players, especially those that are mission-based. And if the government wants to reach effectively those populations, we believe that it has to partner with these players so that the care of cancer reaches every corner of this country. Most times the private sector has the infrastructure and maybe they may have the technical staff. But the challenge for both the patient and the sector is actually access to medication and sundries. So if already the government is providing medication to patients that are accessing the Cancer Institute, the same subsidy or service can be extended to those in the private sector. That if someone wants to receive chemotherapy in the private sector, they should get it subsidized. And what happens right now is that the same patient, if I go to the Cancer Institute, I can get a product free. And just the same person moving into the private sector, I get the same product sold. So you've seen that, again, for HIV care, what we did was that drugs are free both in private and the public sector. So it's free across the board. The other is also the part of training that private sector has not yet developed the capacity to train and build capacity for both oncology doctors and oncology nurses. These are people trained, specialized in care for cancer. And so we believe that these centers can be extensions for training so that capacity is built in those centers. So
on this World Cancer Day, health workers are calling on government, civil society and ordinary Ugandans to unite against cancer through prevention, early testing and better access to treatment.